Hello, everybody, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. This is a series where MCW brings you the science behind the health topics that you're hearing about in the news. And it's actually brought to you by the Advancing a Healthier Wisconsin Endowment, which is a statewide nonprofit that is improving health and advancing health equity throughout the state of Wisconsin. So I'm Calie Herbst. I'm the founder of Milwaukee with Kids. I'm going to be your host today. I am so thrilled to be here to be talking about the topic that won't seem to go away, COVID-19, and specifically today, COVID-19 and kids. So that's what we're focused on today. We're so lucky today to have with us Dr. Frank Zhu. He is a pediatric infectious disease specialist with Children's Wisconsin. He's an assistant professor at the Medical College of Wisconsin, and he's been at the forefront of helping our community navigate all of the new and changing recommendations and just understanding the science behind COVID and kids. So, Dr. Zhu, welcome to Coffee Conversations.
Thanks, Calie. It's great to be here.
Do you have your coffee with you?
I have a frappuccino, so it's
that counts.
Yeah,
that counts. Okay, so we are going to be covering a great list of questions regarding the science behind COVID-19 and kids. We've got a lot of questions that were submitted from the readers of Milwaukee with Kids. And also, I encourage all of you watching to drop your questions in the comments. We're going to be keeping track of those. We're going to be trying to respond to those as best we can. And we'll be dropping some resources in the comments as well, so keep an eye on that. So Dr. Zhu, can we please start with the big picture? So where are we at nationally and where are we at in the state of Wisconsin? Give us the numbers that are the most important that we need to know.
Right. So I think nationally and in the state of Wisconsin, what you heard in the news is probably generally correct, in that the cases are starting to trend upwards again, both in Wisconsin and throughout the country. So if you look at the Wisconsin DHS website, they do have a nice little tracker with the cases there. So you can see that, we were, back in early November, our peak was, almost 7,000 new cases a day. And we're not up that high yet, but, we're up to almost 700 cases a day, which is certainly higher than, less than 100 that we were at sort of near the beginning of this month. So it's definitely on the upward trend.
Okay, so were the numbers that you just said, 7,000 was the peak, like way back when, and now you're saying it's about 700 a day?
Yeah, so the peak in Wisconsin back in November was just under 8,000. And now we're about 800 a day. So
Okay. So are you concerned with what you're seeing? Are there any positives that you're seeing in the data?
Well, I think it's certainly concerning that the cases are going up. I think the positives are that, over half of the population is vaccinated, and while we certainly see breakthrough disease with vaccinated individuals, they tend to be less severe. So my hope is that even if the cases start spiking, we won't have nearly as many severe cases as we did in the beginning of the pandemic.
Okay, so let's definitely talk about the Delta variant. We just want to make sure we're on the same page, first of all. So what is a variant? Can we talk about that first?
Right. So what a variant is basically, as the virus sort of continues to circulate throughout the community, it will mutate. And these mutations can change the qualities of the virus. So some mutations will be unviable and they basically will die off. Some mutations may make it less infectious but more severe. Some variants can make it more infectious and more severe. So basically, it just kind of changes. A lot of the sort of infectivity and severity of the disease can change with these mutations, and because they're changing sort of the character of the virus, it can also affect how quickly our immune system can recognize it if we had COVID before, or if we have been vaccinated. It can certainly also reduce the effectiveness of vaccines.
Okay, so can you tell us, please, how this is impacting kids? Like, are kids getting sicker from the Delta variant? How concerned do we need to be that with Delta and kids?
It's difficult to say if kids are truly getting sicker with Delta variant, but it does seem that kids are becoming infected more commonly now than previously in the pandemic. So kids do sort of make up a sort of larger proportion of new cases than they did earlier. But this is also kind of tempered by the fact that kids are far less likely to be vaccinated since the vaccine's only approved for ages 12 and above. And there's a large chunk of kids that are under the age of 12. So I think there's more to come for that, but we are sort of seeing more cases in children as the days go on.
Okay. So we already have a lot of questions from people who are watching, and that's great. And I want to get to those right now. So how likely is it for a vaccinated person to spread COVID to another vaccinated person? So we're trying to think about how to manage interactions, with other vaccinated people.
Right. So the data from this is still, being collected. So we don't know exactly for sure. But what we do know is that a decent amount of vaccinated people are getting infected with COVID with relatively mild cases. And this has been seen, Israel has reported, their health ministry has reported this. And when you look at their data, about half and half of their new cases are vaccinated and and the other half are unvaccinated, but the vaccinated cases are less severe. And here, there's no really published data on effectiveness of vaccines as time goes on. There was some limited published data from England back earlier this year, which said that Pfizer's vaccine effectiveness may have dropped by about 5% with Delta, but that does seem a little bit low when you see all these sort of breakthrough cases. So I think we don't know what the likelihood of a breakthrough case with Delta variant is quite yet. But if you do get a breakthrough case and you test positive, you're going to be able to transmit it. Because remember, even if you're vaccinated and you don't have symptoms, but they test it, but you get a test for whatever reason and it's positive, it may be that you have a little bit of virus in your nose. It hasn't really gone into your system fully to cause symptoms to infect you, and your vaccinated immune system is going to take care of it. But as long as that's there in your nose for a short period of time, you'll be able to transmit it. Now, transmission between vaccinated groups is probably going to be lower than unvaccinated. And certainly if you get sick from it, it's going to be less severe, but how much lower, we don't know. But I think it's one of those things where you'll just have to balance, how large you want to make your social circle be in terms of, organizing these group activities.
Okay. So you're saying that more and more kids are getting infected because of the Delta variant. So a lot of parents I'm talking to, and we received a lot of questions about long-term effects in children. What do we know about the long-term effects in children of COVID-19?
So it's really difficult to say for sure. In adults, it's been more reported that sort of this long COVID syndrome where they have maybe persistent fatigue or other symptoms that last long after the infection is over. And certainly that has been reported in children as well. But how clear this is related to their COVID infection or perhaps like an immune response to their COVID infection, it really is difficult to say since we don't really have a lot of reports of it, although it certainly does happen. And the most common long-term complication of COVID that we worry about in pediatrics is MIS-C, which is the multi-system inflammatory syndrome in children, which usually occurs about a month after COVID infection. And it's sort of this very intense immune reaction where they can have fevers, rash, and sometimes more concerningly, they can drop their blood pressures. And it can be dangerous if not treated quickly. So because of that, I think that having COVID does put you at risk for this. And if you sort of develop unexplained fevers after, a few weeks or more after having COVID, it's very important to let your doctor know that my kid had COVID previously, so they sort of make sure that they can think of the syndrome.
Okay, so it's interesting. We actually had a reader or a person who's watching right now. They said that their child has post-infectious syndrome, and they were asking about that inflammatory reaction. So does that make him more likely to get the inflammatory reaction to COVID-19?
That is difficult to say for sure. Certainly, a lot of diseases can cause a post-infectious syndrome. And does that necessarily mean that because your immune system is kind of primed, it's more likely to go into this sort of dysregulatory cascade that leads to MIS-C? Unfortunately, we really don't know that for sure, but it is certainly a possibility.
Okay. So let's shift gears just a little bit and talk about vaccines. I think a lot of us were relieved when the vaccine came out. We all kind of breathed a sigh of relief. Now, obviously, things are starting to ramp up again. Where are we at in terms of, first of all, when do you think the vaccine is going to be approved for kids 12 and under? Like, if you had a crystal ball and had to give us a guess, what would you say?
If I was forced to bet on it, I would probably say sometime mid to late fall to early winter. There's been, obviously, Pfizer's already been sort of collecting the data about that. And some of their sort of investor reports and things like that suggest that they would be submitting their emergency use authorization in mid fallish. So that's where I would guess. Now, we don't know for sure if their data is very strong, although given how the 12 plus age group data looked, it probably is. We just don't know for sure yet, but I would hope that it is. I would hope that it is earlier rather than later in the fall, so that we can sort of stem off viral season.
Okay, so what are they looking at right now in terms of safety for kids under 12? Like, what is it that they're concerned about or just looking for to be able to approve this vaccine?
Well, basically what they're looking for is they're looking for how effective the vaccine is at preventing disease, and sort of comparing that with the other age groups that they already have data for, and how effective and then how safe the vaccine is. So sort of a combination of efficacy and safety. And with the younger children, they may be trying to look at lower doses as well, because some vaccines do have lower doses for younger children. Although I'm not sure if they're going to end up using the lower dose for the Pfizer vaccine. I heard that they might be keeping the same dose, but we'll have to see how the data looks.
Okay. So many questions about the vaccine. We have a question asking, should we continue to wait until further research is done on the vaccine before, vaccinating our children? Because obviously some people are like ready to go, but other people are, have questions about this vaccine. So do you think we should wait till more research is out, even after it's approved, or what do you think about that?
I personally would recommend getting the vaccine if possible. I think the way you sort of have to look at it is that, regardless of children or not, millions of people have gotten this vaccine at this point, and the side effects, while certainly present, are generally minimal and mild. And even the more severe side effects that we sort of seen with Pfizer, such as the myocarditis that was reported predominantly in young men, they actually recovered quite well in the hospital and didn't result in any significant mortality. So I do think that overall the side effect profile is quite favorable. So I would get it, because if you're waiting for more data, you're going to need to wait for an extremely long time, because the only data that isn't really going to be seen by this point is long-term data like years out. If 20, 30 years from now people get some like Guillain-Barré or some other sort of side effect, and at that point you're just not going to get the vaccine.
Okay. A lot of questions from readers about the vaccine and very young children, like toddlers.
Mhm.
When do you think that it might be approved for toddlers, or what other issues, come up around the vaccine and toddlers and babies and all of that?
Right. I mean, so if you, parents with toddlers and very young infants to remember that the vaccine schedule is pretty intense during the first, 1 to 2 years of life. And a lot of that has to do with the different types of vaccines that we recommend in that age group and when we think the vaccine will be effective. So, so I think that because of that, because the sort of Pfizer and Moderna vaccines are mRNA vaccines, so these are a new type of vaccine, their effectiveness in sort of the younger age group will need to be evaluated more rigorously, because if you think about our current vaccine schedule, for example, measles, mumps, rubella, and varicella, the MMR and V vaccines are not given to children until they're 1 year old, because when they're younger, these live vaccines may not be as effective, and the weaker immune system, may not be able to take care of it as well. So because of that sort of quality of sort of the developing immune system in young children, we'll have to see how effective the mRNA vaccines are in that age group before we really sort of determine is there going to be an age cutoff for it.
Okay. We had somebody ask if they can actually pass immunity to their baby or toddler through breastfeeding if they had received the vaccine, or is that passed along at all?
You will have partial immunity will be passed along. So the immunity that we all sort of think about, sort of like the antibody tests and your antibodies, one specific type of antibody, the IgG antibody, is sort of passed through. So you will be able to, even if you're pregnant, it will pass through the placenta, and some of that will be present in your baby and slowly fade as they get older, because they're not making it themselves over the course of a few months. And similarly, breastfeeding will pass along these antibodies, which will provide a measure of protection, but it's not the same as your own protection, because there's a lot of other parts of the immune system, like T cells and things like that, that are not passed along, that also play a role in your immunity.
Okay. So last question for now on vaccines. I've heard a lot of this asking about the COVID vaccine and fertility/miscarriage. Can you speak to the risks there, if any?
I personally have not seen any data on that would suggest that the COVID vaccine would affect your fertility. In terms of miscarriage, I believe the trials in pregnant women are ongoing, but sort of the recommendation was that pregnant women can certainly get the COVID vaccine. It's not indicated in them. It's just that in the sort of emergency use authorization, there was a lot of pregnant women in the study groups to prove its safety, but we don't anticipate that it has any adverse effects on it.
Okay. Okay. So a question from somebody who's watching right now, and I got this from a lot of other people as well. So we've got the Delta variant being, more infectious. So should vaccinated parents of unvaccinated kids lock down again? Like, is that where we're at?
I think that's sort of that's a good question. It really reflects upon sort of how much risk you feel is acceptable, to sort of balance out the obvious need for sort of social interaction, things like that. I mean, kids do need that. There has certainly been a lot of sort of harmful effects of lockdown on children in the last year. But what I would say is that nothing has significantly changed for unvaccinated children in terms of how susceptible they are to COVID now than a year ago. And they may be a little bit more susceptible, since we are seeing cases increase a little bit more quickly in children now because of the Delta variant. So I think that it would be a good idea personally to sort of maybe not completely lock down, but certainly sort of pick a sort of social circle that of a relatively smallish social circle that sort of you have your children sort of interact with, and try to sort of minimize activities in sort of large crowded settings. I think that's sort of the best compromise we can sort of give for them.
Okay. Also, a lot of questions about, what advice would you give to two working parents, but they have kids under 2, and, they need to send them to childcare or whatever, and there's these places dropping mask requirements. What do you recommend for people who they want to protect their kids who are unvaccinated, but now with all of these, whatever businesses and childcare centers are choosing to do, a lot of people are looking for guidance about how they can protect their unvaccinated kids.
Right. So I think that it's certainly going to be difficult if you can find an area find a sort of a childcare center and things like that has not dropped its mask requirement. That would probably be the most ideal. Or maybe you can sort of start to petition the ones that you have, because you have to remember it's sort of CDC sort of has come out and said that even if you're fully vaccinated, in areas of substantial or high transmission, they recommend you wear a mask in public settings indoors again. And certainly, much of Wisconsin is sort of in that substantial to high transmission area, specifically, where we are at in like Waukesha, Milwaukee counties. Those areas, these two counties are, certainly is substantial and high. And you can go to the sort of the CDC COVID data tracker county view based on their website, and you can zoom into Wisconsin and you can see which counties are in those areas. So I think that would be sort of the best thing to do, because obviously, if both of you work, you're going to have difficulty finding childcare. And if you don't have, like a family member or someone that you kind of trust to watch your children, you're going to have to use childcare. So I guess it's really just going to be trying to find one that uses more sort of precautions.
Right. So you mentioned masks. Let's talk about masks. They're back in the news. Who should be wearing them? Why? Just give it to us straight.
All right. So basically what I would say is, in general, you should be thinking about wearing masks in public indoor settings. Certainly, if you're unvaccinated, the recommendations have not changed. You should be wearing masks in indoor settings. The only change previously was that if you're fully vaccinated, they said that, in public indoor settings that you did not need to wear a mask. But then the CDC walked back on that recently because of the increased cases in fully vaccinated individuals. So the current recommendation for the CDC is, in areas of substantial or high transmission based on their tracker, fully vaccinated individuals should wear masks in public indoor settings. So honestly, what I would say is, personally, I think that was sort of the minimum I would recommend. I think that even if you're fully vaccinated, it'd be a good idea to wear a mask when you're in public indoor settings where there's a lot of people around that you don't know what's going on. The Delta variant, makes up something like over 90% of COVID cases in the United States currently, new COVID cases. So if you get exposed, it's likely going to be to the Delta variant, which likely your vaccine, while it may prevent severe diseases, that may not prevent mild disease very well against. So I think it'd be a good idea just to wear a mask in public indoor areas in general.
So then are masks kind of here to stay, in your opinion? I mean, at what point do you envision them going away, on a wide scale?
I think masks are here to stay for the short term. There may be, we don't know what will happen sort of in the fall and winter because certainly there are possibilities of, of booster shots of vaccines, and that are certainly currently in development and being looked at. There's a possibility of, specific shots against the Delta variant and things like that may sort of change the calculus about how protective it is and your ability to transmit once fully vaccinated. But I think in the short term, they're here to stay.
Okay, so great question from somebody watching right now. You mentioned the psychological impact of lockdown on kids earlier. So, is there any known psychological impact of mask wearing, like if they're full time wearing masks in school? I know a lot of people are concerned, especially with younger kids, not being able to read facial expressions and things like that. Can you speak to that at all?
Yeah, I don't think we'll know the full impact unless this continues throughout the school year and people do sort of the studies and look at it. I think certainly there will be some effect on young children because obviously facial expression and things like that are quite important for people to sort of develop social cues and social cues. So there may be some unfortunate side effects to wearing masks that we do not know yet, but it's difficult to know exactly where it is. My hope is that at some point people will become more creative with their mask development, and you can have maybe more clear masks and things like that, where you can sort of at least see most of the people's faces, and that will be less impactful. But we'll sort of have to see how that plays out through the fall.
Okay. And so with COVID, you mentioned, kids are mostly getting mild symptoms with COVID, right? You mentioned that it's right, it doesn't present as severely in kids. So where does our concern lie? Obviously with kids getting it, is that they then pass it to adults who it could present severely in? Like where do you think the concern is? Obviously you don't want your kids to get COVID, but can you speak to that at all?
Right. So kids generally do get mild symptoms, although certainly some kids, are unlucky, so to speak, and can have quite severe symptoms. So there's always the possibility, even if the chances are low, if it's your kid that is, the one in how many thousand that actually gets severe disease, it's for you, it's 100%. And then the other concern is sort of what we said before with the MISC, is that's a syndrome that can also have a variety of presentations, but can be severe and rarely sometimes fatal. So MISC is a significant concern in children who have been infected with COVID, because after 2 to 4 weeks, they could have very severe disease as a result of sort of their immune response to their COVID infection. And also there are some concerns with sort of long COVID, so to speak, as well, although unfortunately we don't really have a lot of great data on that yet.
Okay. And how does that compare then to like the flu season? Like how much more risky is it for kids to develop severe COVID as it is with like flu that we've always kind of lived with for many years?
Right. So, I don't have the exact numbers in front of me, but I think in terms of respiratory disease itself, the initial disease, it's probably not too dissimilar in that many children get the flu and it's kind of just like a respiratory virus and they recover without incident, similar to how many kids get COVID and recover without incident and have even minimal symptom. There'll be a small percentage of both that have severe disease, a small, not a insignificant amount, but a small number of children do get severe flu and do die from it every year, similar to how a small number of children will have COVID and die from it as well. So I think the sort of initial respiratory disease is probably fairly comparable, and if anything, perhaps flu is a little bit more severe. But then when you look at sort of the post-infectious complications, flu is generally not associated with things like a lung infection like long COVID, and flu is not associated with something like MISC, which is really a phenomenon that we have not seen until sort of COVID came along. Although there are a few childhood diseases that present similarly, but not the same, like Kawasaki disease. So realistically, I think the long-term complications of COVID may be worse than flu.
Okay, that's really, really helpful. We have so many other questions. You're very in demand. Okay, so tell us about being outdoors with kids right now. So a couple things, like can unvaccinated kids play outdoors together safely right now? And same kind of thing, like how risky is it to take unvaccinated kids to an event like the state fair that's mostly outdoors, but you're with kind of a crowd? Can you speak to that, please?
Mhm. Right. So the reason why recommendations are different outdoors than indoors is that when you're outdoors, there's much more air around, there's wind blowing, there's much better sort of ventilation. So if someone has COVID and is coughing, it's going to be spread out very quickly, and your exposure is going to be shorter and likely less. So in general, it's better to be outdoors than indoors. If your children are playing outdoors with other unvaccinated children, there is going to be some risk, especially if one of them is infected, especially if they're really close together, and they get coughed on, or they're wrestling or something like that. So there is always going to be some risk. So what I would, and sort of similarly for a state fair, is that it's good that you have better ventilation, but if you're around a lot of people in close proximity for a long time, it's going to raise your risk as well. So I think it's really one of those things where the likelihood of you getting COVID transmission between unvaccinated people is sort of based on a variety of factors. Being outdoors decreases the likelihood by a good amount, but if you're in close proximity to someone for a long period of time, or in close proximity to someone or to a large number of people for a long period of time, that's going to also raise your risk a little bit. So there's going to be some risk to, going to, say, like a state fair, or playing with a lot of children in close proximity. But outdoors is better than indoors. And if people are masked, that will certainly also give you some protection as well and lower the risk.
Okay, thank you. Okay, so a question that I'm sure a lot of people have, especially as cases are rising, what's the best way to handle a positive case in just one child in the family, right? So you've got a bunch of kids, one kid is positive. Like, do they all mask at home? Is that what you would recommend? How do you approach that?
That's a good question. Generally, what I would say is, if one child in your family at home is positive, then all of you are already considered exposed, because most likely you've been in close proximity with this person for greater than 15 minutes without a mask on. So my personal recommendation would be that you're kind of already all exposed. I mean, if you really want to be extremely careful and have everyone wear masks indoors, you can. But in practice, I think that's very difficult to do for such a prolonged period of like the entire day you're at home. So generally, I would just recommend that consider yourself all exposed at home, and you should try to sort of you should basically quarantine if possible, in terms of minimizing your interaction with other people until the quarantine period is over. And that period can be quite long, because technically, after your initial diagnosis, that person's considered infectious for about 10 days, until their symptoms have recovered, have completely resolved. And then after that, your quarantine period would begin. So it'd be sort of 10 days plus, depending on which quarantine duration you sort of subscribe to. The most conservative is 14. If you get testing, you can get down to sort of 7 and things like that. So it would be sort of a long period of time, but you would be considered exposed to them, so you could possibly be kind of incubating the virus the whole time.
Right. Okay. A couple of questions from concerned parents about schools that are not requiring masks in the fall. So they're concerned about their unvaccinated child attending a school that is not requiring masks. And what would you recommend for those parents?
I mean, I share your concerns. I guess it would just be, it's very difficult to know exactly what is sort of the best for your child at that point, because it's sort of a balance between the risk of getting COVID and the risk of having sort of suboptimal virtual education. I think we all know that children require in-person education to really get the most out of schooling, and the last year has certainly taught us that. But there is going to be, a significant risk of transmission if a large proportion of your class is not wearing masks, because if one person happens to be positive, which is not unlikely because of how COVID is currently spreading, then a lot of that class is going to be exposed. So their classmates are going to be at risk for developing it, and depending on what your quarantine sort of measures are, they could be missing a lot of in-person school, or going to school while possibly incubating the virus. So I would be concerned about that, but at the same time, you sort of have to balance that with how realistic is it for your child to do virtual school because of that.
Right. So as kind of a follow-up question to that, what is the supporting research that you would personally give a school that was not requiring masks right now? Like, what would be something that a parent could share with them to just help nudge them in a different direction, if that's what they wanted to communicate with the school?
Right. So I think the best thing you can say is that you can show them sort of the AAP statement that says we recommend, regardless of vaccination status, that all children that can tolerate masks be masked at school. And AAP is the American Academy of Pediatrics, and certainly the CDC would sort of support that statement as well. At the end of the day, schools that decide not to enforce this mask mandate are doing it against the recommendations of the medical societies, and I don't know realistically if showing them sort of supporting data will necessarily change their minds so much, since they're basically accepting that they're going against the advice of the American Academy of Pediatrics, for example.
Okay. And can you touch on the effectiveness of the vaccine for kids with autoimmune conditions? So this reader has been told that they may not develop enough immunity because of having those autoimmune issues.
Right. So if you have altered immune system in some way, your response to vaccines, or your response to a vaccine, is going to differ from someone with a normal immune system. And certainly we have seen that even before the Delta variant, that breakthrough infections were far more common in patients with a suppressed immune system. So for example, if you got the vaccine, but you were undergoing treatment for cancer or something like that, and you really didn't have a very operational immune system, like breakthrough infections would occur. And it's probably similar to a lower degree with autoimmune conditions, since your immune system is sort of attacking the body and not quite working in the normal fashion. Although how different your effectiveness would be is difficult to say for sure. If you have only a very mild one, you may have far more protection than someone with really severe disease. And until there's sort of more data and sort of looking at these specific groups, we won't know the exact difference in effectiveness.
Okay. All right. We are going to do two more questions, even though there are many more, but we don't have enough time, but we're going to do two more questions. I wanted to ask you, a reader wants to know what guidance you would provide for a family with a higher risk child who cannot yet be vaccinated. Tell us about what you would do in that particular situation.
I mean, if your child you feel like because of their underlying medical conditions are at a higher risk for developing severe COVID, be it they have a suppressed immune system, or they have altered lung reserves or lung physiology and things like that, I would just be a lot more conservative in terms of social interactions. Make sure that everyone that they interact with is either vaccinated or masked, and certainly if they're going to go to a school that does not have a mask mandate, I would probably favor doing virtual schooling in that case, since it seems like they would be at a higher risk for developing, more severe COVID.
Thank you. Okay, so our last question is from somebody who is watching today live, and they are wondering if the medical community is tracking reinfections in pediatric cases.
So currently, I don't believe that the CDC is sort of tracking reinfections in pediatric cases. It would be interesting to see that data, because I think part of the breakthrough infections and vaccines may be related to the timing that you receive the vaccine. We know that depending on the vaccine you get, sometimes the immunity wanes more quickly than other vaccines. So, like we know, like whooping cough vaccine in children, we know the immunity wanes over the course far more quickly than sort of, say the chickenpox vaccine. And that may be contributing to the breakthrough, since a lot of the population, was vaccinated in the beginning of this year. And we know that respiratory viruses historically, if you get like the common cold, you quite commonly would have very short immunity to that specific virus, maybe a lot of timelines of a few months. So it would be interesting to see that data, but I don't believe that it's currently being tracked.
Okay. Thank you so much. We did cover a lot. If we didn't get to your question, you can drop an email to conversations@mcw.edu. I want to thank Dr. Zhu for joining us today. You were so helpful. I personally feel much more informed. And I hope that you all can join us next month for a virtual coffee break and another really informative conversation on science. Thank you, everybody.